So I'm a public health nurse, and I am the program coordinator for Child and Teen Checkups in Dakota County. And I'm just going to run through, whenever I do these kinds of presentations, I think people are looking at me going, we're already doing that, or maybe they say, no way, we can't do that because we don't have enough people, we don't have enough money, that isn't what we do. I hope that today what you can do is pull a few nuggets that you can take back with you and think about that this might be something that we could do, or you maybe could also give me some ideas about directions that we could go, and I would love to have you do that. So first of all, let's see, what do you think? No? Got an idea of a direction? All right, so how did it begin? Well, Minnesota's Tooth Fairy appeared. Now, some of you might know the Tooth Fairy, and, well, she doesn't exactly look like that. But have you lost a tooth? Because maybe she does, and you just haven't seen her when she's doing that other part of her job. Let's go, since I'm not going anywhere. There we go. Oops. How about that? So, here's what she told me. All Dakota County kids should have healthy mouths for healthy lives. And so it began, because I agreed with her. We had the same theory. Why should Child and Teen Checkups be at the table? Well, Child and Teen Checkups staff assists families with medical assistance eligible children from birth through age 20 find medical and dental care. And we know that when we are meeting them in their homes, in the community, and when we're calling them on the phone, that this is a really difficult thing for them to do. And in fact, our 2015 statistics show that only 33% of Dakota County MA-eligible kids receive preventive care. That seems pretty sad that that's where we're at. This is just a basic table showing you the number of kids we had in that age group, or at that time, which was over 35,000 kids, which is the far left, how many we actually had, and then how many had care that was related to caries or pain or something like that, and our poor little kiddos who are, and then our really awful numbers of kids who are getting preventive care. So we thought about this, what are we going to do? And then, of course, we had to mull it around for a while because we're a county, and you have to go and get lots of approval from every level of people anywhere. And so we finally had enough evidence. Mary and I and my supervisor, Coral, worked really hard to find what are the statistics that we can bring, because that's what's going to make a difference with our administration. And they said, okay, let's give it a try. Go ahead. So we called our partners. And I'm not going to say every single partner that's on my list, because there are lots. But these were people that we knew. So any contacts that we had, we were calling. So it was hospitals, it was dentists, dental clinics, community colleges, our school, nurses, the health plans, anybody that we thought might have an interest in doing something with kids that were in our community. And we even pulled a few other people in along the way to help out with some specific projects. So our first meeting, it was basically presenting the data to the group that we had there, talking about what our proposed vision was, and then also identifying gaps and coming up with some activities and solutions among all of our group. And so we did the yellow sticky thing, or the whatever color stickies we had. Everybody, we gave some thought to what are those things that are the issues and what are some things that we can actually do, and then categorize them in areas that helped us to think about how we could progress, how we can create a work plan from this. And basically that's how it began. At every single meeting we have, and in fact we were going to meet quarterly. As the group started, they said, no, we need to meet more often than that to get started. We're going to lose our momentum. We've got to keep going. And this group, every time we get together, here's our work plan, and we start to talk through what we're doing on the work plan, and they're like, but then we should try this, and if we just did this. And so facilitating the group is in fact like herding cats. In a really positive way, and I like cats, so it all works out for me. But it really is a group with such great ideas and great enthusiasm that it does make a difference. You know, the right people keep coming back to the table, and I appreciate that. The work plan was huge, and every time, as I said, that we met, it changed, and we added more things to it. So when we first started, and I'm really not putting these things up here so that you're reading every bit. I'm just kind of giving you a little sense of, well, let's have something on the page besides some words. But I just wanted to let you know that we started with that whole activity, outcome, timeline, location, and others included and resource needed. And then all of a sudden we realized that we had a really hard time figuring out how are we going to track really what's going on each and every time, and what tasks did people agree to doing, so that I could send it back out and say, so here's what you said you'd do. Are you actually doing that? Is this something that we need to find other partners for? Where are the roadblocks along the way? And so that has been really helpful to have that piece. So we've been together for a year. And so we're doing a little celebration. We, you know, I think that first I looked at the things we'd done and I kind of went, oh, I don't know if it's enough. You know, are we doing the work that we should be doing? But we all know that we've just started, and that there's really so much that we still want to do. But we still should celebrate those pieces that we have done. So our first goal was to ensure children and families are aware of the importance of oral health and know how to care for their teeth. And so that seems pretty big, but there were lots and lots of ideas about ways that we could go about doing that. So we had education at the table. So this one was a really natural one that we would be looking at. So we did provide dental education and materials for professionals who work with children. There was oral health assessment training done for one of our school districts, which is West St. Paul, and that was done for all of their school nurses. Now, what were they going to do with that oral health assessment training? We weren't exactly sure, quite honestly. Was it going to be at a point that it really just raised their level of kind of considering that there might be something going on in the mouth? So if kids were coming in, they would feel at least comfortable taking a quick peek and saying, yep, or at least, you know, calling home and saying, has there been have you had a preventive checkup lately, and can we help you out with that? So that was really kind of that first little piece. There's training done. We started it in one district. We'll look at whether or not we want to go farther than that. And I think that our school nurses had an interesting take on that, because sometimes school nurses in an education system are not the most, let's say, highly valued people on the team, because the money's got to go to the education for the kids. And so how do we value our nurses who are in that location also? And so our nurses were saying, well, let's have some more skills. Let's show that this is really an important thing to use a nurse for, that we can continue to add to that value of our nurses. And so these nurses did buy into this idea that that they would have to extend their capabilities, because the mouth, you know, for nursing has not been the highest priority either. So I think that it does give us a different view. Our tooth fairy also provided materials for our schools so that there could be education within the school system, and yet another great thing that that our school nurses were appreciative of, and then also our community college partners that helped with that. And then fluoride varnish was another piece of that. So our child and teen checkup staff assessed fluoride varnish application at our 37 primary care medical clinics in Dakota County. So we have an electronic health record system that actually allows us to do forms so that we can keep data. And this is, again, you know, if we want to keep data, if we want to really show that we're doing the work, we also want to be able to pull that data, to have reports available so that we can show that this is an important thing to do. And so we found that at that time, 17 of those clinics were applying varnish according to the Child and Teen Checkups recommendations to MA kids, not necessarily offering it to kids who were not on medical assistance, because a lot of private health insurance and medical clinics, it does not pay for fluoride varnish application. That was all pre-October 1st when changes came into effect with Child and Teen Checkups. And for those of you who don't know, fluoride varnish application is now required at all Child and Teen Checkups from the eruption of the first tooth through age 5. So at every checkup, the medical clinic is doing fluoride varnish application. If kids, if they were at the dentist last week and mom says, they were at the dentist last week, I know they had fluoride varnish applied, they can just document that and they don't have to apply at that point. But when we think about most of our kids, we can't find a dentist, especially under age 3. So if we're starting at that eruption of the first tooth, I look at fluoride varnish as one of those things that's a little like, and applying at that early age, it's a little like the changes that were made to Tylenol bottles back in the old days. It's one of those things that infant Tylenol, concentrated Tylenol, was in bigger bottles, and kids were drinking down the Tylenol and having the effects of doing that. So we made this change. We said, okay, well, so parents, it's really hard to protect kids. So here's what we're going to do. We're going to make little teeny bottles of Tylenol, which will kind of make you mad sometimes because you have to go buy another one. But your child is not going to be drinking down an overdose of Tylenol. And I think I look at fluoride varnish like that too. So, yep, you know what? The best thing would be is if you made sure that every day you were making sure that you were cleaning those teeth really well. But sometimes life happens, and that doesn't always occur. If you're looking for new housing or food or whatever, that might not rise to the top of your list. So we're going to fluoride varnish you. If you can just get in for those baby visits, we're going to make sure that we help you protect those teeth. And so I think that is a really important change that we've made. We also have done some fluoride varnish training at one clinic, and actually that will happen at more clinics soon. So the people that are actually going to be doing the varnish application are taking the online training first, and then we go in and do some hands-on training with them, and also just kind of think about what that clinic flow is going to look like for them. We bring along all of our fun toys and actually practice that. What positions might work for you? Give it a shot and see how this works for you. Because a lot of our clinics actually already have their staff trained. They just haven't really figured out how it's going to work for their clinic and with their process. And they're kind of hesitant to be getting their fingers in and around mouths. So, really talking through what that would look like. We have done our Child and Teen Checkups team did fluoride varnish application at one school backpack event, and that's always an interesting thing to have a whole bunch of kids coming through getting their backpacks and their haircut and their whatever else they're getting that day from at the school event, and then also saying, could you not eat those suckers that other booth is giving you? Because we'd really like to apply some fluoride varnish today. Kind of a challenge sometimes. Here, we're going to take that out now. But actually, we find each time that we do this, we find kids who have never been to a dentist, haven't been to a dentist for years and years. And we don't just apply varnish. We're also always doing some troubleshooting with them to make sure that they can find, or hope that they can find dental care that is going to work for their family. So these are fun and interesting events, and there's paperwork to fill out because we are the county, and it actually is but it's a really good thing for us to do. And my coworker Judy is here today, and that's Judy's head, and she's a very famous head there. We also partnered with Normandale Community College and Metro State College to have their students go out and do a survey with all of our clinics that they could get in the door, but really just to talk about what are the things, who are you serving? What kinds of concerns do you have? And to let them know that we have a public health nurse who is interested in working with them to talk about community resources, because we know that if they're going to serve families who have needs, they may not be prepared for that. And so we would like to help them prepare for that in any way that we can. So it's helping set up our relationship with those dental clinics ongoing. Another piece of that was our oral health fluoridated water education to parents and children. Our home visiting staff do oral health assessment and education for all our moms and children's. So again, part of our electronic record actually has oral health assessments for our pregnant women, for our little children, and our infants, so that we are doing the assessment, and that really triggers for us what is the education that needs to happen. We've also done education to kids at schools, at Head Start, and community sites wherever we can. This has been our year of the tooth, and so we have done all kinds of things out there. Utilize this handout from the Department of Health in much of the education that we've done. And then also done started oral health screening at early childhood screening. And this is one of those areas that we really wanted to increase our activity, because we know that that's a great time to catch those kids, and they should be getting in for their screening anyhow. Our second goal was to increase kids' access to professional dental care. And you know that things happen for a reason. True North is actually not in Dakota County, it's in Scott County, but Shakopee is south of the river, and our folks in Dakota County like to stay south of the river. And so they might be willing to go to Shakopee where they wouldn't go to Minneapolis or St. Paul. So that things happen for a reason. Bill actually bought the house of one of our staff on our Child and Teen Checkups team, and that's where she met him first of all. So we do think that things happen for a reason. Our schools are doing some work with mobile clinics. Children's Dental Service actually is working with our school district 191, which is Burnsville, and they have a site in Burnsville too. Child and Teen Checkups, we've started our dental clinic visits, and then we've also discussed dental care with families with 3,525 families so far in 2017. We've talked to a lot of people, and most of them actually don't have a dentist yet, or don't even know that their health insurance covers dental care. And goal 3, well, this is one where we're not very far in. Advocating for changes to policy and that would promote positive oral health in children. However, we did get a one-page flyer. We had 2 days to pull that together, I think, Mary, and gave it to 2 of the legislators who were making a site visit, and our administration will plan to take that to the Hill when they have their Take It to the Hill day. So what's next? Well, we're updating our work plan. Well, I'm always updating our work plan. Finding ways to coordinate more efficiently. Our colleges who have done education in our schools are continually, we just want to make sure that we aren't stepping on toes of other people who are coming in to do the same work. So we're doing some work on coordinating that. We're looking at writing a grant to look at an oral health care at another school site. So that's a big one that's coming up. Exploring increased oral health assessment for our early childhood screening. So we started in one school. We'd like to go to the bigger school system, to Burnsville, and see what we can do with that. And also, not just within our school system, but talking to the Department of Ed about what could be added into early childhood screening. Is that a direction that we should go as a requirement of of early childhood screening? And then finally, I think we're really looking at ways to engage more dental health professionals. I think we have more external people that are part of our team than dental health professionals. So again, looking for more people that really that have a different view than what we have in our public health department. So lots of things still to do. We're continuing to move forward, and I'm really excited for the year to come. I think we have a really great start. So in the end, it's really just remembering our vision, that all Dakota County kids will have healthy mouths for healthy and, we hope, happy lives. Thank you.